Okay, let's go back to Professor Paul Hunter. We were speaking to him earlier about the rising number of cases in Europe, the WHO saying it's now the epicenter of the pandemic. Professor, just let's pick up where we left off there. You were saying something along the lines that the rising number of cases was partly due to some of the vaccines possibly waning by this stage.
Yeah, no, I mean, I think it's more than possible. We know for a fact that vaccines, the protective effect of vaccine doesn't last forever. And over the course of even just 6 months, some of the vaccines are showing a significant reduction in their protective effect. And I think, at least especially in Western Europe, who vaccinated quite early, we're seeing that actually working through and being one of the causes of the increase, at least in Western Europe. In Eastern Europe, it's somewhat different. The vaccine coverage is rather less than it is in Western Europe. But in that case, we're moving into the winter where people are spending more times indoors. And we know during winter, respiratory viruses like coronaviruses, like influenza, can spread more rapidly. And that's also a driving factor. And particularly, I think, in countries that have not had much disease before now, the relaxation of restrictions while they're still effectively in the epidemic phase will also be contributing to this surge.
So, Professor, is it time now for Western Europe to start rolling out those booster shots?
Well, we are in the UK, and we're already seeing some impact of that. Cases have started falling a bit more quickly in the older age groups, the over 80s, which were the first to get the booster shot. And in the last few days, we're seeing some decline in hospitalizations as well. And some of that is because case numbers as a whole is dropping in the UK. Primarily, I think, because a lot of, particularly our younger people, have actually had the infection already and recovered, and that's providing quite a strong additional protection over and above the vaccine. But also, I think we're starting in the older age groups, the people who have had the booster are beginning to see fewer cases and fewer hospitalizations because of that.
Do you also feel that some parts of Europe are now closer to possibly herd immunity?
Well, herd immunity doesn't exist for coronaviruses, and we will never get herd immunity. And herd immunity is the indirect protection of individuals, and that's how the World Health Organization defines it. What you have with coronaviruses is you have immunity, which lasts for a number of months, and then you get reinfected again. And because of that particular life cycle of the virus, it's impossible to get herd immunity. What you get is reaching some form of equilibrium, some balance, which is the number of infections you're likely to see going forward. And I think in the UK, at least, we are probably close to that and closer to most others because of what's been happening in the UK over the summer. But you know, this is a virus that's going to be with us forever. But ultimately, as many specialists have pointed out, this will become, like its predecessors that have caused coronavirus infections, just another cause of the common cold.
Yeah, just something we're going to have to learn to live with. Professor Paul Hunter, thanks so much for your insight.
My pleasure.